Hi, I'm Dr. Joseph Dayan, and this is Sheila, our nurse practitioner specializing in lymphedema. Sheila, I couldn't do this without a large team, and I'm blessed to have a really caring, highly capable and talented team. Sheila performs the ICG lymphangiography, which is one of the key studies we use to determine if somebody might be a candidate for lymphovenous bypass, and also to generally assess the lymphatic system in every patient. Kind of like an X-ray for an orthopedic surgeon, the ICG is that for lymphatic surgeons. And it's amazing working with Sheila. She comes from a very rich background. She's taken care of some of the sickest and most challenging types of patients. Pediatric transplant is her initial background for many years, and so we're very privileged to have her be part of this team. And we actually, Sheila and I just did an ICG lymphangiography today, and we have a whole slew of them for the rest of the day. But I just wanted to, we were just talking about the actual exam itself, and do you want to say a few words about what the patient actually should expect?
Yes, the patient that we just saw, we have made the decision that we're going to take her to lymphovenous bypass. And we just we told her what she should be expecting as far as, pain, which fortunately there should be very little pain, and then just what she should be expecting in the next 2 weeks. That should be a lot of rest and not so much manipulation to that arm, but the procedure in itself should be pretty pain-free, and hopefully and ideally within the next 2 weeks she should be, back to her normal lifestyle. And we'll continue, we're happy to and we're proud to be continuing to follow her care, in the weeks and the months and the time that follows.
What about a lot of patients are concerned about the injections. It sounds pretty painful. Could you tell us how it was for her, or how most patients, what do most patients experience?
So at first we will, the procedure in itself has definitely come a long way. We do inject now with lidocaine, which definitely alleviates a lot of the pain, just to kind of give you guys just to allay some anxiety, prior to coming into the appointments. We're very skilled and we're very good at giving the injections, so they will be relatively painless. And then afterwards we do inject the dye, which that in itself is painless. You'll have a little bit of a green coloring to the top side of your hand, but afterwards you're going to be good to go.
Would you say in general the ICG injection is painful or not so bad? Or
I would say not so bad to pain-free. It is a small injection in itself, but I think for the most part most of our patients are very pleased.
Yeah, I would say with the ICG, when you hear about the injections, most patients have some anxiety about the anticipation of pain, but actually we do absolutely everything possible to minimize or eliminate any pain. And most patients, I would say, have minimal to no pain. It's not just the lidocaine, but also the injection technique we use, exactly where we're injecting, and we're using the tiniest needles that you can get in an office. So I think it's come a long way, and patients generally have a very good experience.
Yes.
What do you think about patients being able to see their own lymphatic system?
Oh, I think it offers them, I think they feel assured about, what they're seeing physically, not only just the actual look of the arm, but the way the weight of the arm actually feels, its heaviness. It's got to be very affirming to be able to actually see it up on imaging, to see it up on the screen. It's just like, it puts into a picture like how they are actually feeling. So I feel it's very affirming.
And I think it's also extremely useful to us for patients with very early stage lymphedema where, it may not be clear their arm or leg doesn't look that big, and they may have been told that they don't have lymphedema, or it's probably nothing to worry about, or we'll see what happens. But the ICG definitely gives you a clear picture of the lymphatic system. So it will either let you know if the lymphatic system is fully intact and normal, or if there's actually an abnormality, even when it's hard to tell on physical exam. So it's a very sensitive test for picking up any abnormality in the lymphatic system.
It is such an honor, it is such a privilege to be a part of this team, to not only have state-of-the-art equipment and technology and have, you know, the best innovation available to us, but to be able to work under Dr. Dayan, who has truly made it his life's work to bring his, you know, experience in surgery and microsurgery to an institution and to the public and to his patients. It is, you know, it is something that I am very happy and so proud to be a part of, and I can't wait to be able to bring it to his patients.
It's definitely not you know, not about any one person and not about me, but I feel privileged to really work with such an amazing team. To take care of patients at the highest level really requires many sets of eyes on that patient with a variety of different perspectives and expertise. Everybody here brings something individual and unique to the game and to the evaluation of the patient. The patient needs multiple ears, they need multiple people caring for them, and we want to take you by the hand through the whole process. And so I'm in an environment where I'm elevated by the people around me, and the real focus is on you, the individual. We're really here to serve you. We're here to try to get you well as best we can. And having the privilege of working around the latest technology, having access to newer technologies coming down the pike, and working with engineers, founders of new startups that are really bringing in the future to the present. This is very exciting, and I'm very fortunate to work with you, Sheila. I feel very excited about the future, and thank you so much, Sheila. It's really great to work with you.
Proud to be here.